Would you like to learn how to deal with blocked milk ducts? I'm going to teach you today how you can successfully breastfeed your child even if you have a blocked milk duct. I'm Marianne Ryan, I'm a physical therapist, and I treat lots of women with blocked milk ducts.
I'd like to give you some tips on the best ways to deal with blocked milk ducts. A lot of people are very surprised to learn that physical therapists actually can treat blocked milk ducts. And what we use is a deep form of heat, which is called ultrasound. And this is a breast, and we use that to kind of help loosen up the area of blockage, along with manual therapy. But I'm going to give you some tips that you can try on your own, or if you're getting treatment, it's something to do when you're at home. So the first thing is, before you nurse your baby, or if you're experiencing blockage, or if you suspect that there's kind of like an area of density, some people call it a lump, or if you're noticing a big decrease in supply, and if you have a painful area, you probably have the blockage. The first person you should consult with is your lactation consultant. If you don't have one, I highly recommend that you get one, because they're trained to help women with these issues and to help you get a better latch with your baby, and that will prevent you from developing blocked milk ducts. So the first thing I do is I teach women how to, what we call palpate, or feel for the area that's blocked. So what most moms do, they come in, their breast is all red and sore, or even black and blue. And that's because they've been rubbing really hard on the blockage. And that actually can cause more damage than good, because it can cause some internal bleeding a little bit in the ducts themselves, because you're pressing too hard and you're actually causing an injury. So what you're going to do is imagine, say right in this area, there's a blockage. And so the first thing that I teach women to do is first take a nice hot shower, not too hot, nice, or else use moist heat for 5 to 10 minutes prior to doing the massage. In my clinic, I use ultrasound to kind of help loosen up the milk. And then what I teach them is to do a massage that is, I call it the J stroke, because you kind of go down and you swipe to the side. You go down and you swipe to the side, as if you're forming a J or an opposite of a J. So you go to the perimeter of the blockage, not on top of it, and you press your fingers in together. Not hard, it's gentle, it shouldn't hurt too much. And you press at a 45-degree angle, and then move your fingers down towards the nipple. You press in and move, you press in and move. And you can do this with both your hands at the same time. And I actually do it rhythmically, because I try to, I don't know, kind of happen naturally, but when babies nurse, there's almost a rhythm to it. And the same thing, even if you're using a pump, there's a rhythm to the pump. So you kind of just do it together, and you might start seeing some milk coming out of the nipple. The second massage, and that massage you might want to do in 5 to 10 minutes, sometimes a lot longer, it depends. You'll get to know what works for you. The second massage is for expressing the milk, and what you're going to do is take 2 fingers and put it below the nipple, and that basically just stays there. It's going to kind of hold the nipple up. That's the job of these 2 fingers. The thumb is the one who's going to be working, and what you do is you press down and you pull the skin. Don't rub over the skin. It's a pulling, as if you're milking yourself. There's no better way to put it. And so you start at the nipple area, and you do that for a couple of minutes, and then you can move backwards towards the blockage. And again, it's gentle pressure, and you'll see that it'll increase the flow, hopefully, and you may even see some spraying of the milk, and that means it's opening up. So another trick that I teach moms is I teach them to use an electric toothbrush while they're either while they're pumping or prior to nursing. So you might be saying to yourself, what am I going to do with the electric toothbrush? Now, if this is the area that's blocked, you're not going to take it and brush your breast or even use the head of the toothbrush. You're going to use the body where you're feeling the most vibrations. And what you're going to do is just rub over the area, kind of roll it. Don't press too hard. And keep on doing this for about 5 minutes to even 10 minutes before nursing your baby. And you can do it while you're using a pump. So once you have the flange on your nipple, you can then turn the toothbrush on and roll it over as you're expressing milk. Just like so. Okay? Things to be wary of, or just as a warning, if you're running a temperature, call your doctor. If you're seeing an area with a lot of redness and it's very tender to touch, call your doctor, or if you have a midwife, call your midwife or your lactation consultant. You know, because it could be an infection and it must be looked at by a medical professional. The other thing to also be wary of is if you develop kind of like a crust around the nipple, that might be another type of infection. So that's when you want to pull in and get some people to help you. Don't do this alone. There are, you know, either call your doctor, midwife, lactation consultant. People are there to help you. Don't sit and suffer. Because it can fester and become infection like a mastitis. So we want to prevent that.